The next topic is the diseases of the dental pulp. What is dental pulp? Dental pulp, it is a delicate connective tissue that is mixed with the tiny blood vessels, lymphatics, nerves, and undifferentiated connective tissue cells. So the dental pulp, it is the part in the center of tooth that is made up of living connective tissue and the cells known as odontoblast. What does the pulp contain? The pulp contains the blood vessels, the nerves, the connective tissue, and provide tooth, blood, and nutrients. What is pulpitis? The inflammation of pulp is known as pulpitis. So what are the causes of the pulp disease? According to the Grossman, they either can be physical, that could be either mechanical, or due to trauma, or due to the pathological wear, crack through the body of the tooth, or barometric changes. The thermal includes heat during cavity preparation, exothermic heat that can be generated during the setting of the cement, conduction of heat and cold through deep restoration without using a protective base, or the frictional heat during the polishing of the restoration. Electrical causes could be either galvanic shock. The chemical cause includes using phosphoric acid or erosion. Third, bacterial cause, that could be associated toxins that are associated with caries, direct invasion of pulp from caries, or anacoresis. According to the Grossman, we can classify the pulp disease based on clinical features into either it can be reversible or irreversible. The reversible can be symptomatic, that is acute, or asymptomatic, that is chronic, whereas the irreversible can be acute, abnormal response to cold, or abnormal response to the heat, or could be chronic, asymptomatic with pulp exposure, hyperplastic pulpitis, internal resorption, pulp degeneration, or necrosis. There may be partial pulpitis or subtotal pulpitis depending upon the extent of involvement of the pulp. If the inflammation is confined to portion of pulp, usually a portion of coronal pulp such as pulp horn, the condition is partial or focal pulpitis. If most of pulp is diseased, then it is total or generalized pulpitis. What is difference between open pulpitis and closed pulpitis? When there is, so this classification is based upon presence or absence of direct communication between the pulp and the oral environment, usually through a large carious lesion. Open pulpitis is used if those cases of pulpitis in which pulp communicates with the oral cavity. When there is no such communication, then it is closed pulpitis. So what is anacoresis? It is transportation of microorganism through blood or lymph to an area of inflammation, such as tooth with the pulpitis. Aerodontologia, the toothache occurring at low atmospheric pressure, experienced either during the flight or during a test run in a decompression chamber. So it is generally observed in high altitude over 5,000 feet. So you have to remember it is seen, arrow means air, during a flight or during a test run. A tooth with chronic pulpitis, it will be symptomless at the ground level, but it will at the higher altitude it will cause pain because of the reduced pressure. So treatment, it consists of lining the cavity with varnish or base of zinc phosphate with sub-base of zinc oxide eugenol cement in the case of deep cavities. So let us discuss pulpal disease one by one. The first comes the reversible pulpitis or It is also known as pulp hyperemia. So one of the earliest form of pulpitis is reversible pulpitis. So in this condition, it is a mild to moderate inflammatory condition of the pulp that is caused by stimuli in which the pulp is capable of returning to the uninflamed state following the removal of the stimuli. Suppose we apply ice or cold fluid to the tooth that result in pain, but when you remove this stimulus, it will found that such teeth would return to the uninflamed state following the removal of the stimulus. So the etiology, it could be trauma, thermal shock, excess dehydration of the tooth, galvanism, or bacteria from the caries. So here the tooth will be sensitive to the thermal changes, especially cold. The pain will be of short duration that will disappear on the withdrawal of the thermal irritant. The tooth will respond to stimulus by an electric pulp test at a lower level of the current, indicating a lower pain threshold or a greater sensitivity than that of adjacent or normal teeth. So the teeth that usually show reversible pulpitis are the large metallic restorations, deep carious lesions, or restoration with the defective margins. So what are the histological features? Number one, you will see the microscopically it is characterized by dilation of the blood vessels. Of the pulp vessels, oedema fluids may collect because of damage to the capillary walls, allowing the extravasation of RBC or some diapedesis of the WBCs. There will be slowing of the blood flow, and that could cause thrombosis. So the treatment is the remove the irritant or stimuli before the pulp is severely damaged. If the primary cause is not corrected, extensive pulpitis will lead to the death of the pulp. We can use cavity varnish or base application before the insertion of filling. A care should be taken during cavity preparation and polishing. Next comes the acute pulpitis. What is acute pulpitis? Extensive acute inflammation of pulp is a frequent immediate sequela of the focal reversible pulpitis. Although it may also occur as an acute exacerbation of chronic inflammatory process. So acute pulpitis, it is usually seen in the tooth with a large caries or restoration, commonly a defective one. So severe pain that is elicited by thermal changes, particularly when the patient is taking ice or cold drinks. The pain persists even after the thermal stimuli has disappeared or has been removed. So the etiology, that could be the bacterial invasion, chemical, thermal or mechanical cause, or the reversible pulpitis that may deteriorate into the irreversible pulpitis. So in the early stages, what you will see, it involves a portion of the pulp, usually the area just beneath the carious pulp. The teeth will be extremely sensitive to hot and cold stimuli, and there will be increase in the pain intensity, and that will persist even after the thermal stimulus have been removed. So intrapulpal abscess formation will be seen that will cause severe pain, lancetating or throbbing type. That will be the characteristic feature of the pain. The pain can increase when the patient will lay down. So why does the pain occur? the pulpal pain that is not only caused by the pressure buildup due to the lack of escape of the inflammatory exudate, but also by the pain producing substances that are relieved by the inflammatory. So the pain will subside when the drainage is established or when pulp undergo complete necrosis. The tooth will be not tender to percussion unless the pulpal inflammation has spread beyond the root apex into the periapical region. So there will be a rise in the pulp pressure along with the inflammatory exudate, the local collapse of the venous part of the circulation that will result in local tissue hypoxia, and that will cause the pulpal abscess. Now what are the histological features? There will be continuous vascular dilation that is seen in the reversible pulpitis, accompanied by accumulation of edema fluid in the connective tissue surrounding the tiny blood vessels. So there will be edema in the pulp with the vasodilation, infiltration of the PMN, polymorphoneutrophils along the vascular channels, and that will migrate through the endothelium lined structures. There will be destruction of odontoblast at the pulp dentine border, the abscess that would consist of pulp, leukocytes and bacteria. So what is acute suppurative pulpitis? It is numerous abscess formation that causes pulp liquefaction and necrosis. So the treatment is drainage of the exudate from the pulp chamber. You can do pulpotomy and place calcium hydroxide over the entrance of the root canal or root canal treatment. Next is the chronic pulpitis. So when there is persistent inflammatory reaction in the pulp with little or non-constitutional symptoms. So in the chronic pulpitis, the pain will be not a prominent feature of the chronic pulpitis. There will be dull, mild pain that will be more often than intermittent than continuous. So there will be, what you will see, there will be degeneration of the nerve tissue in the affected pulp, and the threshold for stimulation by the electric pulp vitality test that would increase. So in case of the chronic pulpitis with wide open caries and exposure of pulp to the oral environment, there will be relative little pain. The pulp will become totally necrotic and show there will be no symptom or little pain. So on histological, there will be infiltration of pulp tissue by varying number of mononuclear cells, chiefly the lymphocytes. So you would see the lymphocytes and the plasma cells. So the treatment is the root canal treatment. Next is the chronic hyperplastic pulpitis. What is that? It is the overgrowth of pulp tissue outside the boundary of the pulp chamber as a protruding mass. So other name of chronic hyperplastic pulpitis is pulp polyp. So it occurs in children, that is the young adults who possess a high degree of tissue resistance and reactivity and readily respond to proliferative lesions. It involves the large open carious lesions. So you will see a pinkish red globule of tissue that is protruding from the pulp chamber that will not only fill the caries defect but also extend beyond. So it is a slow progressive caries. So it occurs due to the slow progressive carious exposure of the pulp, a large open cavity, a young resistant pulp, and a chronic low grade stimulus, they are necessary for the chronic pulpitis. You will see that the teeth that are more commonly involved by this phenomena, they are the deciduous molar and the first permanent molar, because they have excellent blood supply because of their large root opening and high tissue resistance and activity in the young person.